Good morning, students. Today is a cervical spinal special test. Okay, the cervical spine test, the main common test is special test for office oral spine assessment. Cervical compression test. This test mainly for vertebral artery. The vertebral artery, the bone inside the nerve canal is a compression to the vertebra. This cervical spine test. Positive for cervical radiculopathy. Then spalling test will also for the cervical radiculopathy conformity test. Pain related to the during compression. It's a pain. It is a left side turn. It's compressed to the head. It's pain relating to the right side. So left side, the right middle side turn is a pain compression to the left side. Okay. Then distraction test is also for the cervical radiculopathy confirmatory test. Why it is that? It's a traction force applied to the head. It's a pain is relieving on the side. Vertebral artery test. This is the purpose to assess the vertebral artery insufficiency. Positive for dizziness or nystagmus. Then shoulder abduction test. Purpose cervical nerve root irritation. Then pain relief when hand placed on the head. The shoulder abduction test were also for Burkhardt sign. In the case of application, C4 or C5 nerve root irritation also be used for thoracic outlet syndrome. Thoracic spine test for used to assess the thoracic mobility and rib dysfunction. The rib springing test purpose rib hip hypermobility, positive for pain or restriction. That is called in the diagnostic representation. The pressure at the end of the expiration of the rib. Okay, it will stimulate the deeper inspiration. Okay. Then thoracic compression test is the purpose fascial joint pathology is positive for localized pain on axial compression. Then lumbar spine test is mainly for key test for lumbar nerve root irritation joint assessment. Then key test for lumbar nerve root and joint assessment. First one is a straight leg rise test. Okay, the purpose of the test is to detect the lumbar radiculopathy. The positive sign is radiating pain down leg. Okay, the first in this diagrammatic representation, first is the below the bottom of the level is normal. Then below first second stage is 30°. In the 30° is elevated leg is the pain started. Purely a pathology of the spinal vertebra compression. Okay, that is a lumbar radiculopathy. Then next the yellow color line is mainly for compressive neurogenic pain. Okay, that is a 45°. Then almost more than 60° is a muscle pathology. Okay, this identification mainly for that is a straight leg raising test. Then slump test. The slump test purpose of the neural tension of the sciatic nerve, positive reproduction of the symptoms. There is a slump test in this diagrammatic representation. The first picture, the slump test is neural physical examination, disc bulge or herniation of the spine. Then it was first described as Charles Lagos on the French physician. First one is the sitting at the edge of the table, eye sitting. Then patient is neck flexion. Then third position, knee leg is extended. Then is keeping the neck flexion knee extended position. In case lumbar radiculopathy, pain is provoked to the hip to lower limb. Then femoral nerve stretch test is mainly for lumbar nerve irritation test, positive for pain in the anterior thigh. The femoral nerve stretch test is way of eliciting root of the high pain radiculopathy. Then prone instability test is the purpose lumbar instability, positive pain decreases when leg lifted. Then quadrant test or Kemp test, that is a facet joint involvement, that is a localized pain during extension or rotation. Extension and rotation is the pain is present. Pelvic compression or distraction test mainly for purpose of the SI joint dysfunction test, pain in the SI area. Then Ganslin test mainly for SI joint pathology, pain in the SI region. Then Patrick test, that is also called as Faber test, that is the purpose of the hip or SI joint involvement, positive in the groin or shoulder pain. Then Scopa test mainly for assess the lumbar mobility, positive less than 5 cm increases. Okay, in this diagrammatic representation, the 10 centimeter above the iliac crest, 10 centimeter above the iliac crest marking. Then the dimple of the venous or iliac crest line, the 5 cm below the iliac crest. A 5 iliac crest 5 10 cm above the iliac line marking, then iliac crest below the 5 cm line marking. The differentiation of the line is that less than 5 cm is increases of the scuba test. That is a law. That is a patient who are mainly for lumbar mobility reduces. The summary of the spinal test is mainly for help the identify the cervical, thoracic, and lumbar pathology, always interpret the clinical correlation. So this is for the in-class assessment. The Spaulding test is used to detect what is muscle tightness, cervical radiculopathy, and thoracic outlet, and shoulder instability. Second question: a positive distraction test is in the cervical spine indicates what is the answer? A is a nerve compression, the facial joint dysfunction, and disc prolapse and muscle spasm. Then which test assesses the vertebral insufficiency? Spurling, slump, vertebral and quadrant test. During the slump test, symptom reproduction of suggest neural tension, SI joint pathology, muscle weakness, joint stiffness. In straight leg raising test, primarily stresses the which nerve? Femoral nerve, or sciatic nerve, or tibial nerve, or orbital nerve. Case scenario: the 40 years old office worker present with leg pain, relating to the right arm, worsened by the extension and lateral flexion. Question: identify two appropriate special tests for interrupt the first result. That is a swirling and distraction test. Radiculopathy increases with the compression lured by traction. Then next is a case scenario. A 25 years old athlete complains of hamstring tightness and the posterior thigh pain in the forward bending. Which spinal test would be used to differentiate the neuromuscular cases? A slump or SLR test, neural pain reproduces which dorsiflexion suggests neural tension. Okay, thank you.